It's time again for a senior moment with Nurse Linda. Welcome to the STRN network, the future of internet, radio, and TV today. This is Dr. Charles Campbell, the man behind the curtain, and this is Nurse Linda. Good morning, Nurse Linda.
Good morning.
It's actually afternoon, but who knows?
Depends on when you're watching.
We cover everything. Our three segments today include sleep apnea, narcolepsy, and natural sleep.
Yeah, since we started last week talking about the silent killers, this will sort of continue in that segment, except this, instead of talking about cardiovascular diseases, which is what we did last week, we'll talk about sleep.
Okay.
And these can be very dangerous things for you. Number one, we're going to discuss sleep apnea and what it is, what some of the causes are, and how you can recognize it, which is very important.
And what exactly is sleep apnea?
It's when something is obstructing the flow of air into the lungs. And that's usually, especially as we age, the soft tissues in the back of our throat relax.
Your uvula, for instance?
Yes. And that can cause blockage while we're sleeping.
That causes snoring?
It's exactly what causes snoring, yes.
Okay.
And many people don't realize they're experiencing sleep apnea. They may feel tired in the morning. They may have a headache, because lack of oxygen will do that to you. They may feel uncoordinated. They may complain of feeling fuzzy in their head. Those kinds of symptoms, because they're not getting enough sleep at night, but they don't recognize it unless someone is there with them to notice the signs, which is excessive snoring and periods where you actually stop breathing.
Oh, stop breathing.
And that's apnea. Apnea is the lack of breathing. And you begin to snore and usually snore louder and louder and louder and then stop. And when your body builds up enough carbon dioxide, your lungs get a message, breathe again, and then people tend to take that very deep breath and then start breathing fast, and then they get into a regular rhythm of breathing again, and then they start the snoring, and the snoring builds and builds and builds till they stop breathing again. So it's a cycle. And this kind of cycle can go on for as many as 20 times an hour.
Ooh.
Yes, it can be very frequent. So you can imagine your sleep this whole time is being interrupted. And in our last segment, we're going to talk about the importance of normal sleep. But your body, in essence, is being awakened that many times.
And that keeps you tired.
Keeps you tired, absolutely.
Well, my wife is in long-term care, you know. And when the first day I went to visit, she has a roommate. They have a curtain that goes around the roommate. I thought it was a guy. This is the deepest, loudest snore I have ever heard in my entire life.
Mm-hmm.
And it turned out to be a diminutive 5'4" lady, a little overweight, but loud.
Mm-hmm.
I mean, you could hear it down the hall.
Mm-hmm. Yeah.
And then she'd stop. Sleep apnea?
Well, and it's a matter of, does your snoring stop, but you keep breathing? Or does
I
everything
couldn't
stop?
tell.
Exactly. Because some people are just normal snorers. They're going to snore, wake themselves up a little bit, and go back to breathing again. But it's the people who actually stop breathing, and that not breathing can last anywhere from 15 seconds to up to almost a full minute. Now, part of the problem here is people who aren't getting enough sleep, who aren't oxygenating their lungs and their brain and their tissues well enough, tend to have other health problems. They may have high blood pressure because of the stress on their cardiovascular system. They may actually have heart attacks during this time. You're putting a strain on your heart through the constant lack of oxygen. People with sleep apnea will also be more prone to strokes.
That means you could die in your sleep.
Yes, you could.
Now I lay me down to sleep. Praise the Lord. Yeah, get that prayer in there, folks, because you need that. Need that.
Now, and there are some people who are more prone to this than others.
I remember waking up, not being able to breathe. I aspirated some phlegm or something in my throat. And I, of course, didn't panic because I knew what to do. I just breathed through my nose, not my mouth. But that was not fun.
No. No.
I'm not a drinker. I don't drink. but I had a lot of people when I was in college, they would drink and they'd fall asleep and they'd vomit all over everything while they were sleeping. One of them die. Okay, sleep deprivation, bad news.
Very bad news, because that sleep, you're not getting enough sleep at night, you're sleep deprived, and we're actually going to go into more of that in the next segment. We're going to deal with that in detail.
And narcolepsy section?
You can't do a good job when you're sleep deprived. Just bottom line, you can't concentrate as well, you can't coordinate your muscles as well.
When you're driving, it's like having a couple of drinks of
Absolutely.
alcohol.
Absolutely. And actually, that is one of the risk factors for sleep apnea is smoking. People who smoke are more likely to suffer from sleep apnea than others. People who drink alcohol, because alcohol puts them in a very, very deep sleep. Same thing if you use other sedative drugs. If you use them as they're prescribed, you don't have as much of a problem, but when you start overusing them, you get into issues with that. People who are obese tend to have more of a problem with sleep apnea than other people.
I don't notice any sleep apnea.
Mm-hmm.
I used to snore a great deal, but I lay on my side. I don't snore anymore.
And that's one of the things to do is if your loved one tells you, hey, you're having periods at night where you're not breathing, or the wife continues to have to push them to get him to start breathing again. Now, she's not getting enough sleep either. So it's not just a one-person problem.
Well, you're looking at poor memory.
Yes.
Because low oxygen levels.
Yes. But low oxygen levels leading to lack of sleep, the sleep deprivation accounts for poor memory.
My wife says when I concentrate, like I'm writing an article, and she says, I hold my breath. I stop breathing. I hold it. It comes from when I was an artist as a kid. Get real close. It's like a seawell. Excuse me. I get about 4 inches from the paper, and I hold my breath so her hand wouldn't shake. So I guess I've held that over to when I'm concentrating. But I don't have trouble concentrating. Forgetfulness, yeah, I've forgotten people's names for 50 years.
Yeah, this is something that becomes a little more chronic than that.
What's cyanosis state?
Cyanosis is when your skin turns blue, and you can actually stop breathing long enough to have your skin start to turn blue. It's lack of oxygen. It's the oxygen in our blood that gives the blood its red coloring, and that's what gives our skin its pink color and things like that. That's why people who are pale many times are anemic. People have a little blue or an ashy color, sometimes have chronic lung problems.
Okay. Our next section is on narcolepsy. But for sleep apnea, what do you recommend that she see the doctor?
They need to see the doctor and have a sleep study done. Sleep apnea is very easily treated. Sometimes as simple as, like you said, lying on your side to keep it from happening, positioning your head with a very specific type of pillow, which helps to keep your head in a certain position. Sometimes just wearing a mouth guard to pull your bottom jaw forward a little bit will keep those soft tissues from blocking your airway. And some people need a device that assists them at night called a CPAP. And you see them advertised on TV all the time. People wear a facial mask, which just blows a constant puff of air, if you will, into their system to keep the airway open. It keeps it from closing.
Well, let's hope you don't have it, but if you do, see your doctor.
Absolutely.
Or give Nurse Linda a call at 803-941-7231. That number again, 803-941-7231. Our next segment is going to be on narcolepsy, so you don't want to miss it.